Good morning, everyone, and thank you so much for joining us. My name is Megin Nichols, and I'm the lead of the Enteric Zoonoses activity at the Centers for Disease Control and Prevention. I'll be your host for today's program, and I'd like to start by providing a brief overview of the new Antimicrobial Resistance Exchange series. The purpose of this series is to share cutting-edge and impactful research topics in the field of antimicrobial resistance, or AMR. We want to stimulate conversation to drive the field forward and share what we're learning and what's working to find solutions to this really complex challenge. The series is also designed to promote a One Health collaboration across industries, sectors in healthcare, community, and the environment. So this morning, I'll get us started by introducing the panelists for today's discussion. I'm really honored to be joined here by some of my colleagues that I've had the privilege to work with for several years. So I'd like to start by introducing Dr. Greg Habing. Dr. Habing is a veterinary epidemiologist at the College of Veterinary Medicine with the Ohio State University's Department of Veterinary Preventive Medicine. Dr. Paul Plummer is the executive director of the National Institute of Antimicrobial Resistance, Research and Education, or NIAMRI, and a professor and Anderson Endowed Chair of Veterinary Science at Iowa State University. I'm also joined by Dr. Dan Taylor. Dr. Taylor is a veterinary epidemiologist at EpiX Analytics in Fort Collins, Colorado. Thank you all so much for joining us here today, and I'm looking forward to our discussion. So I'd like to get started with Dr. Habing. Dr. Habing, would you care to tell us a little bit more about what you do at The Ohio State University? And I hear it's been cold there recently, so thanks again for joining.
It has been cold. We've had worse years, so it's not been too bad. But yeah, so I'm a veterinary epidemiologist at The Ohio State University, and I do research and teaching. And on the research side, we work on antibiotic use and antibiotic resistance in livestock production systems. And specifically, I focus on dairy production systems because I used to be a dairy vet. And then on the teaching side, I teach preventative medicine and epidemiology to veterinary and graduate students.
Excellent. Well, that must keep you very busy this time of year, especially.
Yeah, we're right at the end of the semester, so we are kind of in the home stretch for sure.
Wonderful. And I find that practitioner perspective often helps with engaging in some of these topics. So I'd like to go ahead and get started. We'll dive right in. So can you tell us a little bit about how you work to implement antimicrobial stewardship programs for animals in your field, and how effective can it be when it's done right?
Yeah, so I mean, again, we work with dairy production systems, including dairy calves. And rather simplistically, I think the overall goal is to reduce the reliance of these production systems on medically important antibiotics, but to do that in a way that doesn't negatively impact animal welfare or the economics of the sustainability of the operation. And so given that that's the overall goal, and we're trying to reduce the use of medically important antibiotics. And then again, simplistically, I think of the total amount of antibiotics used on the operation as some product of the incidence of disease. And then also how selective we are for choosing which incidents of disease get treated with antibiotics. So it's a product of the disease incidence and selectivity. And so then I say that because to reduce antibiotic use, we could either work on reducing the incidence of disease, we could work on the prevention side, reducing the need for antibiotics to begin with, or we could work on making sure that we're very precise and accurate with how and when we choose to treat animals with antibiotics. So for an antibiotic stewardship program, that could be really big, right? And if we talked about the prevention side, we could talk about nutrition and biosecurity and housing and all those things that go into preventing disease. The selectivity side is a bit more digestible and comparable to antibiotic stewardship in other contexts, I think. And so if we're focusing on how to accurately identify those animals that need antibiotics or groups of animals that need antibiotics, then there's a lot of things that go into that as well. So first off, we have to have a good relationship with a veterinarian. We have to have a veterinary client-patient relationship. We have to have established protocols for the common diseases on the farms. We have to have good record-keeping systems. We have to have individuals that are directly trained in how to identify those groups of animals that require antibiotics. And so it's a big process, and there's a lot of moving parts. But it's when we focus on the selectivity side, it becomes a much more tangible thing, and then in a bit of a separate sense, also work on the prevention of disease.
It sounds to me like collaboration with a lot of the producer community is really key, because there's so many environmental aspects to address.
Absolutely, yeah. And so that's one of the areas that we've worked really hard to develop, is our relationships with the dairy producers and the calf production systems. And we want to get engagement from these folks, right? And sometimes it's tough. And so I could talk about antibiotic stewardship and describe it simplistically, but the implementation of stewardship systems within these already complex farms is really where it gets more complex. And so, especially for large dairy farms, I mean, these are complex businesses, and they have a lot of competing priorities. I mean, they're already addressing issues with the environment and animal welfare and food safety. And so antibiotic stewardship isn't necessarily the first thing on their list when they start out their day in the morning. And so we have to somehow get engagement with the dairy producers or the calf producers. And when we talk about the public health impacts of antibiotic resistance, right? That's something that is not very tangible to most farmers. It's way off into the future. It's kind of fuzzy. So that isn't necessarily the best way to talk about. We often talk about more short-term benefits for stewardship programs, such as reduced drug costs or better treatment outcomes. And then we also talk about the potential, the likely public health impacts of better stewardship of antimicrobials as well. But it's much more difficult to talk about the hazy impact on public health, because it's such a complex web that it's and those effects are so far off into the future that it's much easier to focus on the short-term outcomes for antibiotic stewardship.
And I think one of the things that you said that resonates a lot with me is the impact on animal health, and the way in looking at this really complex web of interconnectedness, and just the magnitude of decisions that producers have to make on a daily basis. It seems like by addressing some of the interconnectedness between stewardship and animal health, or stewardship and economics, seems like that goes a long way towards breaking it into some manageable pieces.
Yeah, I agree. And that's a much more accessible concept for most producers, is that if we conserve our antibiotics, then we can conserve them to preserve animal health. And as I mentioned, we work a lot with dairy calf production systems, and dairy calves, like human babies, are susceptible to pneumonia and gastrointestinal disease. And so they really have to have antibiotics available to treat those bacterial infections. Otherwise, there's definitely going to be impacts on animal welfare. And so one of the things that all calf producers struggle with is salmonella. And that's an organism where it can cause really horrendous outbreaks in calf production systems, and they need to treat with antibiotics. But salmonella, of course, is good at picking up resistance to antibiotics. And as a practitioner, I had to manage through outbreaks of salmonellosis in calf production systems. And we had outbreaks of salmonella that were resistant to nearly every antibiotic that we had to use. And so we were in that situation where we were out of tools to try to put out the fire, so to speak. And so that was a very impactful experience. And it's an impactful experience for producers when they have to kind of suffer through that outbreak and try to figure out how to manage that without antibiotics. So there are tangible impacts on animal health for sure.
Absolutely. And I think as practitioners, none of us want to be in that situation where we don't have any more tools in the toolbox that we can reach for in terms of treatments. And I think that lends really well into our next topic, which is talking a little bit about how you and I had the opportunity to work together. So you led a CDC-supported project at The Ohio State University about antibiotic stewardship education for calf producers, which helped to develop a training program and test antibiotic use decision-making tools. Tell us a little bit more about this project and why you think this work matters, including to some of our public health organizations.
Sure. Yeah, that was a great project. We really enjoyed that, and it was good because there were some tangible and measurable outcomes from that project. But the overall problem that we were working on is that I think folks, the general public, might have this image that it's the veterinarian that diagnoses and treats animals on a routine basis, and that's really just not the case. I mean, most antibiotic use decisions on an individual level are made by somebody on the farm, because veterinarians just can't be everywhere at once. We have to rely on producers to make good decisions on when to use antibiotics. They are, of course, supported by protocols from the veterinarian and training by the veterinarian, but we have to necessarily rely on producers to make accurate decisions on antibiotic use. And so that, of course, that decision is not easy, because we're not running diagnostics on a routine basis either on farms, right? We don't have a diagnostic laboratory where we can get a good turnaround time to decide if we can use or if we should use antibiotics. And so farmers are relying on kind of outward signs displayed by the animal and judgments of the disease severity to decide if that animal should get antibiotics. And so we want their decision to be sensitive. In other words, we want all the animals that should get antibiotics to get antibiotics from an animal welfare standpoint, but we also want their decision to be specific. In other words, we don't want them to unnecessarily treat with antibiotics. We want to conserve those antibiotics as much as possible. And so circling back to the past question, when does it go well? In this situation, it went well because we had the entire team engaged, right? So we had a production system where the leadership was engaged, and they said that they wanted to do this, and they met with the individual producers within their production system and said that we're going to do this. And we also had the veterinarian of record on the farm engaged, and then we had our research team engaged. And so the overall goal was to take the protocols that the veterinarian wrote for that production system and then train the producers intensively on those protocols and give them the diagnostic skill sets at the animal level to diagnose when an animal should and should not get antibiotics. And through the course of that, we identified kind of some low-hanging fruit in instances where, for routine, uncomplicated cases of gastrointestinal disease, that they could not use antibiotics and save costs and conserve those antibiotics for more severe cases of disease, and instead use something like fluids and anti-inflammatories, which are going to be really effective in those instances. And so for that overall educational intervention, there were didactic components where we were sitting with the producer and going through what an antibiotic is. So starting at the very beginning, talking about what antibiotic resistance is, why it's important, and then going into how we effectively diagnose calves. How do we measure dehydration, how to appropriately take a temperature, and then lastly, how to put all that information together into a decision tree to make the best possible decision for kind of the routine cases on the farms. And so that was fun to do, right? To talk to the farmers and to work with them. One of the key considerations is kind of the cultural appropriateness of the materials, right? So in Ohio, you can go from a farm where it's primarily Spanish-speaking population, and you can travel 15 minutes and work in a farm where it's a primarily Amish population. And so the materials that we use have to be obviously the right language, and we have to make them culturally appropriate for that population. And so that was kind of one of the considerations that we did when we developed those materials. But lastly, and as you know, Megan, we were able to measure the agreement of the producer on an animal level with the veterinarian. So for the same case of disease, the veterinarian would assess it, and also the producer that had gone through the training. And we had better agreement, thankfully, after the training than we did before the training. And so that was an instance where we were able to implement it and actually measure the impact on learning and antibiotic use decision-making by the producer.
Did you happen to get any feedback? How did the producers and those working at these facilities react to the training? Was there any challenges, any hesitancy?
There was, so the hesitancy, of course, is that, the first thought when we talk about antibiotic use programs is that we're going to come in and be very prescriptive and tell them how and when they can use antibiotics. And that's really not our goal. As the university, as the researchers, we want to work with a veterinarian who is working with the farm, and the veterinarian has the relationship with the farm, and they know the history. They have designed protocols, the most appropriate protocol for that particular farm. So we didn't want to be prescriptive, but rather we wanted to take the protocol that the veterinarian wrote for that farm and then just make sure it was being implemented and that the training happened as it should happen. And so we were actually measuring adherence to the protocol that the veterinarian wrote rather than adherence to some sort of gold standard. But overall, they liked it. They liked the interaction. They learned a lot about, in general, calf diseases and how to diagnose calf diseases. And so it's useful. And they were most interested, of course, in making sure that all the animals that need an antibiotic got an antibiotic, because they of course, they care a lot about the animal health, and they want to make sure that they treat when they're supposed to treat. And so, yeah, it was, I think, rewarding for all of us. It was a great graduate student project, especially for veterinary students, because they got to work directly out in the field and kind of witness the realities of production systems and the barriers there are to implementing antibiotic stewardship on farms.
I think you hit on something that's really key. Sometimes even tackling a really complex issue like antimicrobial stewardship improvement isn't necessarily about designing a whole new suite of tools or really looking at some complex issues. Sometimes it's taking the tools that are already available and just making it a lot easier to implement or more manageable to implement. I think that's incredibly key. And I wish when I was a veterinary student, I had some of those opportunities. That sounds pretty incredible. So looking forward, where do you think we go from here? Can you tell us a little bit about how we keep moving our stewardship efforts forward when it comes to antibiotic use in animals?
Yeah, I mean, as a researcher, of course, I think we need more research, right? But yeah, there's a lot of knowledge gaps out there, and to be honest, and so it's hard. I think when we do have a lot of knowledge already, and we can implement and do a lot. We don't need to wait until we're 100% confident or we've had all the knowledge gaps filled. But with that said, if for instance you asked 4 different veterinarians when the right time to treat with calf antibiotics for calf diarrhea is, you might get 6 different answers. And so there's a lot of variability in what the case definition is for a calf with diarrhea that should get antibiotics. And so there's a role for research there to identify when antibiotics are effective and when they're really not effective. And so there's across a lot of different common diseases, on the cow side, there's very common diseases that are commonly treated with antibiotics. And when we've done surveys of dairy producers and we've given them vignettes and described different cases, mild, moderate, severe, we see a lot of variation and how and when they decide to use antibiotics for both veterinarians and producers. And so I think we can better define when antibiotics are appropriate and when they're not. And then if we have that knowledge, then some organizations, veterinary or producer organizations, can put out, I think, more granular consensus statements on what antibiotic stewardship should look like, when it's appropriate to use antibiotics and when it's not appropriate. So for instance, on the human side, there was a lot of agreement that upper respiratory tract infections should not be treated with antibiotics. And once that consensus was available, there was a lot of behavior change type work that went forward to reduce the use of antibiotics for common upper respiratory tract infections. And so I think that's a pattern that we could follow, but we first have to define, which instances are definitely practices that are not consistent with good antibiotic stewardship.
Yeah, I think you've hit on a challenge that crosses a lot of different sectors, is a lot of knowledge gaps when it comes to certain areas. And then how do we develop tools that can help us to educate and inform some of the practices? And then when we find best practices, standardize those. And I recognize that that is no small task in any sense of the word, which I think this lends itself well to introducing our next panelist, who has worked and looked at some of these consensus statements a little bit more. So Dr. Taylor, I'd like to turn it over to you to have you tell us a little bit more about yourself and about the work you do.
Yeah, of course. Good morning, Megan. It's great to be here this morning with you and the other panelists, and welcome everyone to the exchange. Hopefully you pick up some good nuggets of information here during the talk this morning. But as Megan mentioned, my name is Dan Taylor, and I'm a veterinary epidemiologist here in Fort Collins, Colorado, for a company called EpiX Analytics. I recently completed a PhD at the Colorado School of Public Health in epidemiology, where I did a lot of research looking at antimicrobial drug use, prescribing in companion animals. In my current role at EpiX, our team works a lot with AMR, mainly on the food safety and the antimicrobial use side, and how that translates that risk to humans. So maybe a different end of the continuum than I did during my graduate work, but still in that same ballpark.
That's interesting. We heard from Dr. Having, who works a lot with the dairy setting. What's it like to work on the companion animal setting? I'd imagine that you probably see some similarities between working on the large animal side and working on the companion animal dog and cat side.
Yeah, so like Dr. Having, I had a stint in private practice after graduating about a decade ago. So quite a bit of companion animal experience, which was actually the impetus for going back to graduate school to work on antimicrobial prescribing in these animals. This is certainly an emerging field of research. I think until as of late, a lot of the work looking at veterinary medicine and antimicrobial use was done in the production animal sector. And some of that attention has been turned to companion animal medicine. So I certainly think there are similarities there between the two sectors, but there are also very vast differences as well. The same with when you compare companion animal medicine to human medicine as well. So definitely some challenges there in implementing stewardship principles, but a great opportunity as well, as you were talking about recently, implementing those principles in a easy to use framework that incorporates things that have already been done.
Absolutely. And in thinking about companion animals, I have a cat curled up here next to me. One of the things that we do is we share our environment very, very closely with them. Our animals are often part of our families. They live in our homes. They may sleep in our beds. They have very, very close contact with our family members. And so I'm curious, I wanted to get your opinion, keeping that in the back of your mind. Can you tell us a little bit about some of the risks that might be associated with antimicrobial resistance and in both companion animal health and in our food producing species and the health of those animals?
Yeah, that's a really great point, Megan. I think that all too often we kind of pigeonhole ourselves into one aspect of prescribing and AMR and risk. And a lot of that time, the spotlight gets shown on human medicine, but there are certainly risks involved to our companion animals and food producing animals as well when we talk about AMR. Certainly, there's been quite a bit of work done that shows when animals are given an antimicrobial drug, that resistance does soon follow after. And that risk becomes noticeable when we start to look at the consequence of that development of AMR. And I remember from my practice days, some of the toughest cases involved resistant organisms in dogs and cats, whether it be from a wound, surgical wound or otherwise, urinary tract infections. I think that is another one that practitioners deal with quite a bit. And thinking about that on the individual animal level, we've talked about welfare already a little bit this morning, but that risk directly impacts an animal's well-being, making it very difficult to treat what was otherwise treatable before. Now, whether or not that was the result of one or many antimicrobial drug prescriptions, that's something that's really difficult to pin down. But looking at that individual animal level, I certainly do think that there's enough evidence to show that when animals are given antibiotics inappropriately or otherwise or appropriately, that this resistance does develop and can put that animal at risk, especially if that resistance ends up in a pathologic organism, in a wound or again, the urinary tract system.
Yeah, and I think none of us want to encounter that in our animals when they're sick. We want them to get better. We want them to be able to recover and have those tools. And I know that can be really complicated and heart-wrenching to go through for some owners to have infections that are difficult to treat. I was wondering if you also might talk a little bit more about looking at risk. That seems like a really challenging topic, and it's I'd imagine incredibly complex, but sounds like something you do day to day in your work.
Yeah, we spend a lot of our time here at EpiX looking at risk and trying to analyze that link between antimicrobial drug use, the development of resistance, whether that be in a food product or an animal, and then the translating that link to human health as well. And as you can imagine, it's unworldly in its complexity. I think if there's a word cloud developed from this AMR exchange today, complex is going to be front and center.
Definitely.
So it is a challenge to be able to follow that resistance from development secondary to antimicrobial drug use all the way through the food chain or all the way through human animal contact. The environment is another one. And I think that just exemplifies that AMR is really the quintessential One Health issue. And that you're not going to address it adequately if you just focus on one silo of that issue. So certainly that, going back to the risk component of it, that is a real challenge to be able to link all of those steps. And that can have a number of consequences as well. For example, when we're trying to establish risk of a certain food product, secondary to the use of antimicrobial drug use, the data doesn't exist. And Dr. Havin talked a lot about the data gaps that exist. And without that data to fill those steps in the risk assessment pathway, we really start to incorporate a lot of uncertainty into our risk estimates. And when that occurs, we can get very wide-ranging estimates of actual risk of AMU and AMR in people. So I think the call there is to continue to fill those gaps and to look for different approaches to assess that risk of antimicrobial drug use in animals.
Excellent. And I know you and I have worked together on some research, and you've written about antibiotic prescribing practices in companion animals and pets and how it compares to human medicine. What are some of the similarities and differences between the two, and what are some effective measures to control the spread of AMR between people and animals?
That's a really interesting concept, and that was a certainly interesting project that I was able to work on during my dissertation time. But companion animal medicine specifically, I think, has a lot of similarities with human medicine prescribing. It's on the individual level. A lot of the times it's used for treatment or proposed treatment of a disease, not so much that metaphylactic or prophylactic use that is used in production animal medicine. There are certainly a lot of differences too between the two systems. Insurance obviously is a very big difference between human medicine and companion animal medicine. But for specifically that project, we looked at data that's available from the National Ambulatory Medical Care Survey for humans, and tried to link ICD-10 codes that were associated with upper respiratory disease, by which consensus guidelines recommend no antibiotic treatment. We then took results from a survey of companion animal practitioners that presented very common clinical scenarios that one would see in a veterinary hospital, mainly upper respiratory infections. And what we did with those two data sets is crudely compared the rates of prescribing while considering the uncertainty around those estimates. And ultimately, what we found is that human medicine does have statistically significantly lower prescribing rates than does companion animal medicine. And so really the next step from that is to explore why. And I think that leads to your next question of what are some of the things that we can do to prevent that transmission of AMR from people to animals. So I think first off, there are things we can learn from the human medicine field. There's been a lot of cool technological advances in terms of medical record plugins and audits of medical records that aid the human physician in prescribing antibiotics more judiciously. Whereas in companion animal medicine, we've only really truly started on those very recently of how to improve certain prescribing habits and stewardship. So I think there's a lot we can learn from the human medicine field. And really it's all about engaging all of the stakeholders. For example, on the companion animal side, it's not just the veterinarian and the pet that are involved in the prescribing decision-making process. The pet owner, support staff, other stakeholders in that ultimately need to be considered when we look at improving stewardship and improving use and ultimately reducing that risk to people and to animals from that bilateral transfer of resistant organisms or genetic elements.
Excellent. So leading into this or learning a little bit more, what are some of the key takeaways from the study, and how do you think it could potentially inform and impact what we see in terms of AMR in animals? I know that's a big question.
Yeah. So in looking at those external influences or factors that persuade a veterinarian to prescribe or to not prescribe, it seems that so much of it is an external influence as compared to the patient in front of them and some of those parameters that the patient is presenting with. Certainly clients have, or pet owners or producers have, quite a bit of influence on the veterinarian. And it's interesting because there's been studies done in the past that show that veterinarians perceive that influence, whereas producers or pet owners or clients perceive that it's the veterinarian unilaterally making that decision. So there's a bit of a mismatch there. But I'll tell you, as someone who did practice in companion animal medicine for a while, whether it's perceived or true, that influence of a pet owner on the prescribing practices or anything you do in a healthcare setting is very real. We also found that colleague influences and practice influences also influence whether or not antimicrobial drugs are prescribed or not. The availability of diagnostic tests, the cost of diagnostic tests, the speed with which those test results come back are also barriers to prescribing and can influence veterinarians' decisions to use those drugs. So I think ultimately where that takes us is it helps us recognize that antimicrobial drug prescribing is a complex medical, but also social and behavioral issue. And I think until we incorporate those components of behavior and social acceptance into our stewardship plans, we're not going to cover all the bases. So really, to put it nicely, in a nice package, including all stakeholders in antimicrobial drug stewardship plans and considering the social and behavioral aspects are two launching points that I personally think we as a profession need to incorporate a bit more.
Absolutely. I know in veterinary school, I had the opportunity to learn a lot about some of the best practices when it comes to everything from how you practice medicine to also antimicrobial stewardship. And I think that can sometimes be a challenge when you step out into the real world and you're presented with those first cases that can be really complex and you might have a different network. What do you think are some of the ways that we can help support, especially early career professionals or new veterinarians and other healthcare stewards as they enter into these fields and are faced with some of those challenging cases that you mentioned?
That's a really great question. It starts early for sure. And I know that there have been really nice documents put together by the American Association of Veterinary Medical Colleges that talk about the stages of education for stewardship, starting all the way in FFA and 4-H. But I think Dr. Having and Dr. Plummer will agree that starting with new veterinary students is one aspect to focus on, and just drilling in stewardship and appropriate use from day one. And fostering that understanding until they get into practice. And also equipping new veterinarians with the skills to handle some of those complex social behavioral influences when they get into the clinic. I think it goes beyond veterinary students as well. Certainly support staff play a major role in the prescribing practices in clinical medicine. So starting young there too, early in their education is key. One example that is a bit scary from the clinical world is you'll get a pet owner calling in to the hospital, and the client care representative will be making an appointment to have the pet seen by a veterinarian. The pet owner is describing those signs. Oh, my kitten has a stuffy nose and runny eyes and maybe has a little bit of decreased appetite. And as that appointment's being made, the owner at that point is prepped. Hey, come on in. The doc will give you a prescription antibiotics. Your cat will be feeling better in no time. And so we are priming that decision right there at the get-go. So we cannot ignore the support staff aspects in prescribing. What's more is we can't ignore the pet owner role in it as well. And we have to acknowledge that they want to be part of the process. This generation of pet owners wants to be educated. They want to understand why or why not something is being done. And ultimately, they just want their pet to get better. And sometimes that may lead to the erroneous desire for an antimicrobial drug for their animal.
That can be a really tough position to be in, and especially when an animal is sick, there are lots of emotional components and social components and behavior components that certainly come into play. So I really appreciate what you said about training the whole staff and making sure that there's a culture of stewardship that is set up. I think that's an incredible best practice and takeaway. I'd like to ask a little bit more about some of the technology and technological advances that you've seen and where you think that might be headed, especially in veterinary medicine and animal health in particular.
Yeah, I think there is certainly a place for technological source solutions to improve stewardship in veterinary medicine. One of our most recent projects from a few years ago was looking at what veterinarians perceive as a useful technology tool to help them improve their prescribing. So we did a focus group of about 25 veterinarians and got a lot of good information about what are some of the barriers to stewardship, how they would see a technology tool be implemented in their everyday workflow, and what that that technology would need to include for them to actually use it. And ultimately, we found that time and diagnostic test cost and results, pet owners, those again were all influences on the prescribing practice and decision making, and that a technology would be easy to use, almost a plug-in into a medical software type of platform, something that would be not a chore to use, more of a joy in using on a daily basis, something that supported the veterinarian's decision-making process. Whether or not an antibiotic was prescribed, that tool should support that decision. And ultimately too, and this goes back to including all stakeholders, we found that technology should really incorporate not only pet owners, but the support staff as well. Now, this was a pretty centric study to companion animal owners, but certainly the production animal side as well, technology has a role. And there's a lot of great things that people are doing out there now with things like telehealth and other data analytics to help them support antimicrobial drug use in practice.
Absolutely. I think that's going to be the quote of the day for me, is technology that is a joy to use more than anything else. Well, thank you so much, Dr. Taylor. Really appreciate the opportunity to chat with you. And I think we'll go ahead and transition over to Dr. Plummer. So Dr. Plummer, thank you again for joining us here today, all the way from Iowa. One of the benefits of being able to Zoom and do some of these remote sessions is I get more face-to-face time with colleagues. So I'll let you talk a little bit more about your work and how it interweaves into this complex challenge.
Yes, thanks, Megan. Enjoyed the conversation so far and looking forward to continued conversation. So, as you said in the brief introduction earlier, I'm a researcher and a veterinarian at the College of Veterinary Medicine at Iowa State University. I also serve as the executive director of the National Institute for Antimicrobial Resistance Research and Education, which is a national organization made up of academic, industry, and other stakeholders, and hosted here at Iowa State University. And I have an active research lab as well as the other two speakers. So I'm a veterinary microbiologist and do active research in the lab with my grad students and postdocs. They're the ones that do the work, and I just get to talk about it. So
not a bad place to be in, I would say.
That's right.
Well, I know many of us have been really fortunate to have the opportunity to work with some really incredible students. And I do want to acknowledge that a lot of the work in the stewardship field and research is being done by a lot of them right now. Can you talk a little bit more about some of your engagements with NEAMRI as we've come to know it?
Sure. So as I mentioned, we're a membership organization that engages with a lot of stakeholders. One of the core principles of our engagement is really that One Health approach. And so in all of our activities, we assure and to the best of our abilities, make sure that we have representatives from human health, research, and clinical medicine, veterinary, plants, environment. And so we really strive for that across our membership structure. Across our member organizations, we have mapped and kind of resource mapped and have roughly 1,000 researchers that are working in different areas of antimicrobial resistance. And so that varies from the social scientist and ethicist, over to clinicians, over to individuals working in vaccinology, improved biosecurity, improved health, and even precision approaches, advanced artificial intelligence and machine learning and application of those to veterinary medicine or human medicine. So these organizations, and industry, ranging from really innovative startups that are doing some really amazing stuff in this area to multinational corporations. And collectively, we work on 4 kind of priority focus areas. And those priority focus areas are research, education, as our name would suggest, advocacy and policy around that, and then collaboration is key to that process. And so, a couple of examples that that kind of highlight some of the work that we work on. One of those is a project that's ongoing on developing a One Health data coordinating center, so an antimicrobial resistance dashboard that would integrate data from across the country in veterinary medicine, as well as eventually human medicine, pulling those into a single type of dashboard. And right now, a big focus of that is data privacy and data security. And so obviously in veterinary medicine, we don't have HIPAA-like protections and that the human side has. And so how do we make folks comfortable with sharing that data, that personally identifiable information is not going to be shared? Another example was mentioned earlier around the learning objectives. And so we're currently updating the APLU and AAVMC learning objectives with their help to take a broader One Health focus and try and harmonize and really emphasize from those earliest ages, as Dr. Taylor was talking about, what are key principles that we need to be educating folks around from a One Health perspective, and how do we integrate interprofessional education into that. And then, the collaboration, we try and provide opportunities for networking. So annual meeting, we'll be having our next annual meeting here in May 16th through the 18th next year in Lincoln, Nebraska, and really focusing and bringing folks from all over the country and some from outside into Lincoln to talk about One Health AMR aspects. And we're looking forward to potentially having a strong focus around interprofessional education opportunities at that meeting. But we also support monthly webinars and an online community for members to exchange ideas and just really try and emphasize that that collaborative One Health approach to antimicrobial resistance and facilitate that approach.
So one of my favorite things is when I get to go to conferences and actually engage in dialogue with a really diverse group of partners around the topic of antimicrobial resistance, and to hear a lot of the different perspectives or different challenges that groups are having. I wonder if you might expand a little bit on the concept of interprofessional education and how that really might serve to strengthen some of our approaches and solutions to tackling antimicrobial resistance.
Well, sure. And Megin, you're aware, you worked in as a member of PACCARB this summer, the Presidential Advisory Council for Combating Antimicrobial Resistant Bacteria. We released a report that really details a lot of recommendations around this interprofessional education and One Health mix that allow us to address antimicrobial resistance. And so certainly folks can go to the PACCARB website and read more about that in detail. NIAMRI has also established a task force and we're working in this area, but really some of those key take homes are recognizing that even across our One Health sectors, we often don't share a common language. So we talk about things differently. We have different perspectives. We're experts in our own fields, but when we get together, it takes working together and talking through some of these things to develop a shared knowledge, as well as a shared understanding of expertise, and how we can all work together to address these issues. And so I think the report highlights those, but it's really in veterinary medicine, we think about and we talk a lot about One Health, certainly other sectors do as well. But what we found is when you go to the medical side, they talk less about One Health and they talk about interprofessional education. And really there's a lot of parallels there. And so we're just really trying to pull people together and emphasize how those are very similar and how we can expand upon those ideas to broaden our approach to addressing antimicrobial resistance and improving stewardship.
That's fantastic. I want to turn now to one of the outbreaks that I had an opportunity to work on. And I think this is something that really emphasized to me why it's so important to work in a One Health or collaborative manner with and engage with different sectors and professionals in different groups to tackle this complex challenge is we encountered an outbreak of Campylobacter that was extremely drug resistant, and we picked it up in humans. And one of the key common things that these people who got sick all had was many of them had recently purchased a puppy and brought that puppy into their home. And the other thing that we found out through talking with many of the people who got sick is some of the puppies were also sick at that time. So we were right on the cusp of identifying a resistance issue that impacted both human health and animal health. And although the outbreak investigation was a key component to learning more, one of the things we realized was there was so much we didn't know and so much expertise and knowledge to be gained by interacting with others. So we had the opportunity to collaborate with you. We know pets are a really important part of our lives. They can sometimes transmit diseases, and you've done some really great work around Campylobacter in dogs. And I was wondering if you might share with us some of your findings.
Sure. So, just for the folks viewing, a refresher on Campylobacter here. Campylobacter is a leading cause of human, generally foodborne illness, and it causes GI illness, leading cause in the US and globally, and most commonly associated with either handling raw meat or consuming inappropriately cooked or undercooked meat, perhaps surface water, and water can also be a transmission. But in this case, the apparent link that was certainly epidemiologically supported was that interface with these puppies that had developed a enteritis or a GI disease, very similar to what we see in humans. And so there was questions around, how does this generally present in puppies? How common is this in puppies? This was one of the first times that we really, at least at an outbreak level, saw that transmission. And so we started to delve into that. And while I would say that there's still many gaps and research opportunities that we need to investigate there, we do have enough data from some sampling and stuff that we did to start to understand a little bit of this. And so what we do see is that, while certainly some of these puppies carry Campylobacter jejuni, the majority of them don't. And so it's a small portion of puppies that carry this organism. And much like in humans, where in humans, the majority of Campylobacter patients don't even require treatment or don't go to the hospital. It's self-limiting. Again, in puppies, in a similar manner, we see that some of these puppies that carry this organism don't have disease. And so certainly not all puppies that have Campylobacter have disease. Interestingly, when we look at the puppies that are at the original, at their home of origin, still nursing mom, perhaps, we don't see a lot of resistance in those Campylobacter isolates. But as those puppies mature and get moved through distribution cycles and move from facility to facility or those types of areas, that's where we start to see an increase in the Campylobacter, particularly the drug-resistant Campylobacter. And so that starts to give us insights into it. It almost becomes kind of more of this transportation, commingling, moving puppies from multiple places into the same environment that we deal with as food animal practitioners and cattle and stuff, that some of these principles of population medicine and population epidemiology become more important because we're mixing animals from multiple sites. So, I think the other take home there is, while puppies and pets, all of us have pets, they're an important part of our life. We're in no way recommending that you shouldn't have a pet, but particularly when they're ill or when you're cleaning up their waste, good hand hygiene, washing your hands, and just trying to take common sense measures that you would with anybody in your family that was sick, to make sure that we limit the risk of transmission is really important in our households.
Absolutely. I think that goes a long way. An ounce of prevention is worth a pound of cure. Well, I know that we've learned a lot about approaching antimicrobial resistance with this One Health perspective. And I think that's especially key when we identify new areas and new health challenges that aren't necessarily unique to humans, but also impact our other species. And I think this perspective has been really important. The COVID-19 response has shown us how closely linked humans, animals, and the environment are. And how do you think we can use a One Health approach to really make progress on resistance threats? Where can we really focus to make the biggest impact in the short term?
Well, I think this is a good question, and you know, there's multiple areas. Just in our talk today, we've talked about all kinds of different interfaces of animals and humans, and you know, your previous AMR exchanges were on water and the environment, and so these interactions are all around us. I think one of the biggest things that we can do to move this process forward is we need to identify better ways to fund One Health research. I think you've heard each of the speakers today talk about One Health research, and right now, certainly we have an interest in that. Our national action plan around antimicrobial resistance includes that, but largely our funding agencies still fund in silos of we're a human health agency or we're an agricultural agency. And so particularly in some of these areas, you know, most notably the one around companion animal, you know, right now, if we want to, certainly CDC has been funding some of these projects that we've discussed today, but larger scale funding opportunities that look at the interface of humans and companion animals, where we know there's clear, close association. There's just not many of our funding agencies that are calling for proposals that invest significant amounts of money into exploring those. So I think continuing to build some of those funding mechanisms is pretty important. Certainly we want to build, you know, shared language and methodologies like we talked about. I think one of the hurdles that we often see is, you know, if you look at this as a spectrum, and it's not really a spectrum because we're all working together, but you have human and animal health, and if you think of those on either end of the spectrum, you know, predominantly we use phenotypic testing. So we isolate an organism, we test for antimicrobial resistance. But then the shared environment that we work in, most of the time, those are genotypic tests. They're not isolating an organism. They're looking for resistance using PCR. And so even in our study design of studies, we often don't have comparable data. And as Dr. Taylor talked about in response to one of your questions of, you know, kind of that risk and linking the transmission of these organisms, that becomes very hard when we're all collecting different data, perhaps more similar on the human and animal health, but then the environmental health side. And so we need to also encourage funding organizations and researchers to take a broader approach in our data collection so that we can use that data to better understand these gaps that we have across the board. And then finally, you know, and it's a reiteration of what Dr. Taylor and I think Dr. Having said, you know, an ounce of prevention is huge. And so better vaccines, better biosecurity, better control of disease allows us to never have to get to where we need to use antibiotics. And so investing in those technologies is important.
Absolutely. I think that goes a long way. And I'm really excited that there have been some opportunities for those of us in public health or more on the human health side to collaborate with some of those in the animal health and environment sectors. I think that's been incredible in improving breaking down some silos and improving some of that use of common language, common data, common testing, and engaging more, or at least understanding more where the differences are. I think that's been incredible.
Yeah, I agree. And I think CDC's, you know, led in those efforts. And so we appreciate that, but we just need to keep them up and continue to look for funding to do it. We've all listed more research and gaps as the big issue. And so how do we continue to fill those in?
It's true. I'd like to turn and bring in some of our other speakers to aid in the discussion. So one of the things that we've really been talking about and looking at is some of the impact of antimicrobial resistant pathogens and resistance genes, and learning about how resistance genes go on to potentially convey what we see in terms of phenotypic resistance. And I know that this has also been a topic in animal health. So Dr. Having, I'd like to start with you. What are your thoughts on looking at antimicrobial resistance genes in animal health?
Sure. So again, my context is in dairy cow production systems and calf production systems, and where we see antibiotic resistant pathogens having a definitive impact on animal health is number one for GI disease, and that's specifically for salmonella. And so for salmonella, most people would think food safety pathogen, primarily associated with poultry. But if you're a veterinarian or a calf producer, you've probably had to work with outbreaks of salmonellosis in calf populations, and it's an important pathogen for producers. And in situations where they're dealing with the outbreak, they have to use antibiotics. And so we have pathogens, Salmonella serovars, that are the same serovars that are causing disease in the human population. And veterinarians and producers are using the same antibiotics to treat those infections as are used by human physicians. And so Salmonella can pick up those antibiotic resistance genes, often those resistance genes that mediate resistance to multiple medically important antibiotics, critically important antibiotics, are co-located on the same resistance element. And so we see strains causing outbreaks that are resistant to co-resistant to multiple antibiotics that are commonly used to treat infections in calves and people. So it's another great One Health issue, because it's a pathogen that causes very distinct definitive impacts on animal health and public health. And so when we're dealing with those outbreaks, there's concern for the animal health, but then concern for the workers that are working with those calves, and then concern that the survivors of the outbreak that will go on to transmit through the food supply. So besides that, the other area that came to mind for this question was for bovine respiratory disease. So that's another big challenge for calf producers, for feedlot producers as well. So cattle get stressed and exposed to pathogens and commingled, like Paul mentioned, with dogs. So if they're transported to an environment commingled and then transported again, they're at high risk for bovine respiratory disease, and bacteria are a component of that disease. And so those bacteria can be resistant to a lot of the tools that producers have to treat those. So those are the two big areas that came to mind for me in the cattle context, for where there's certainly an impact on animal health.
Absolutely. And I think you highlighted an interesting point, that those genetic elements that convey resistance, the bacteria don't necessarily keep them to themselves. They might share those, and that can be certainly very concerning. Dan, I wanted to get your take on this as well.
Yeah, it's certainly a complex thing, isn't it? That we can all agree on that not only do we worry about the organism that can spread those genetic elements within their cell wall, but also via plasmids and other types of genetic material uptake. And it's certainly focusing on the journey of those genes would maybe give us a little bit better idea, and give us a little bit more evidence of how to link certain antimicrobial drug use to the development of resistance, and then subsequent, not only in exposure to people, and not only infection to people, but also the idea of treatment failure in people as well. So to link that through the entire continuum certainly has a place in animal health, and integrating that with the presence of those genetic elements in the environment, and also in human medicine as well. So I think we have a ways to go until we get there. But certainly that is almost the holy grail, I think, of assessing that risk of antimicrobial drug use and subsequent infections and treatment failures in people. So there is a place for sure.
Absolutely. And I think it really is about the journey of these genes and the pathogens that can carry them. And I think you highlight there's probably some really complex knowledge gaps that go along with that. And how does selection pressure from antibiotic use or other pressures or other environmental changes or naturally occurring changes, how do those impact what we see in terms of resistance? So Paul, I'd like to turn it over to you for your thoughts.
Sure. I agree with both of the previous comments. The one thing I would add is just an emphasize, and you all discussed this earlier, but the importance of recognizing that resistance does impact our ability to treat our animals effectively. And so from a behavior change standpoint and a stewardship standpoint, we have to recognize that how we use antibiotics impacts our ability and our future ability to treat as veterinarians, to treat our animal patients, whether they're companion animals or livestock, effectively for the diseases that are important to them, in addition to the public health potential consequences. And so just to highlight that, I would just point out that the American Veterinary Medical Association last year released a comprehensive report of the presence of antimicrobial resistant pathogens that are pathogens of animals and its ability to impact animal health. And so that's freely available on the AVMA website. But what through that process we identified was that in every species of animal, we are facing certain disease processes where our antibiotics are becoming less effective or in some cases potentially completely ineffective in controlling that disease. Everything from chickens to turkeys to other livestock to dogs and cats to fish. And so not unlike human medicine, this resistance impacts our ability as veterinarians to treat and care for these animals and their health and welfare. And so that combined with the potential public health concerns really need to make this a focus and increase the need to make sure we're being good stewards of those antibiotics and decision making.
Absolutely. And I know that many of us have probably sometimes felt frustrated when we don't feel like we have the tools or algorithms to make some of those decisions. What are your thoughts on looking across the spectrum of tools? Are there other items that we need to be able to really understand more on this topic?
Is that for me or was that for who?
I'll go for it. You're the first to jump in.
Well, I mean, I think it's having good data, and I mentioned earlier part of the potential for an antimicrobial resistance dashboard or a data coordinating center. In most of our human hospitals, a key component of making good stewardship decisions is knowing antibiograms, knowing what the common resistance patterns are out there, and because of the structure of veterinary medicine, where we're a lot more distributed, smaller clinics, they don't have in-house culture capabilities. In many cases, it's harder to know for sure what resistance is circulating. I think the other thing that relates to that is diagnostics. So animal side, pen side diagnostics. And that's not dissimilar from human medicine where they need them. But the scalability, the ability to apply those diagnostics in very rural areas and the ability to apply those at a very low cost that can be supported by production systems or even pet owners without insurance, as Dan was pointing out, are challenges.
Absolutely. To address some of those challenges, what do you think are some innovative and scalable solutions for mitigating antimicrobial resistance across the variety of animal species? As you pointed out, it's everything from fish to companion animals to poultry to cattle to all the other species. And we rely on many of them for food or companionship. How are we measuring progress in this area? And Dan, I'll start with you.
That's a great question. And I think ultimately, we've done a nice job this morning of highlighting some of the gaps and the barriers and the challenges, but it's really important to recognize that there's a lot of great work going on in multiple institutions, different countries. A lot of nice work is happening right now. So to say that we're not addressing it would be incorrect. One example that comes to mind is these collaboration efforts that exist. And I think it's a call for more of those. To be more specific, the research I did during my PhD was done through the Colorado School of Public Health. And to be more specific than that, through the Colorado Integrated Food Safety Center of Excellence. And these Center of Excellences are spread throughout the country. And essentially, these centers are a collaboration between an academic institution and a health department. And you can start to see where we're breaking down those One Health barriers a bit, those silos a bit, because we're integrating the expertise from human, public health, and animal health. And, as I mentioned, some of the research we've done through the Colorado Center of Excellence, there's also some really great work going on at the other centers of excellences too. Minnesota, Tennessee, and Cornell are all working on some really interesting projects that are both innovative and, we hope, scalable as well. And, I think we have to caution ourselves a little bit in measuring progress. I don't know that we want to measure progress in our ability to accurately estimate risk in AMR. I think by that point, by the time we're able to accurately estimate risk of AMR in whatever facet we're talking about, it's too late. We have all the data. So we really have to promote those innovative and scalable solutions to not only increase stewardship and judicious use of antimicrobial drugs across all sectors, vet med, human med, and agriculture. So it's really measuring the progress in collaboration, in thinking outside of our silo, and working together to really come up with innovative solutions, not measuring progress based on how much data we have, while important. And I think we've all three highlighted that this morning. It's really about that collaborative and tangible impact that we can see.
Excellent. And Paul, I know you've also been working on breaking down some silos and collaborations and bringing new groups and new partners in to share information. I wonder if you might expand on how we look at some of these solutions and then also measure some of our progress.
Sure. Well, I think as we think about scalable, innovative solutions and pulling people together, those are key to addressing this issue. The challenge comes that antibiotics are very effective at doing what they do when they work, when we don't have resistance to them, and so as we develop new alternatives to antimicrobials or new approaches, there's a high bar to reach to get anywhere near the efficacy of some of these products. And so that makes it really, really challenging to prove out and have the data like Dan was talking about. And so I agree with the statement. I think we need to move forward. And one of the things we're always emphasizing is continuous process improvement. And so really for every prescriber, for every user out there, for everybody in the public, how can I do a better job of using antimicrobials, where I'm taking them as a patient or whether I'm prescribing them or whether I'm whatever my role is in that process, how on a day-to-day basis can I do that better today than I did yesterday? And then I think that moves us forward. In terms of innovative and scalable, I think there's a lot of opportunity, a lot of unknowns, but a lot of opportunity in better understanding precision medicine, precision agriculture, capitalizing on some of those artificial intelligence, machine learning opportunities, to better make decisions, and using those analytics that we have to inform and give us better information on risk and likelihood, and then integrating those in. On the agricultural side, there's a lot of work with folks from that are involved in NIAMRI and a lot outside NIAMRI working on identifying sick animals earlier. So, obviously we have these large populations of animals, lots of animals, and it becomes very difficult. You can't do a physical exam on each one of them every day. And they certainly don't get up in the morning and say, I feel sick. Now they may not come to eat or they may not drink. And so how do we capture that information at a population scale using artificial intelligence and videos and stuff to help us identify illness early, or which allows us to intervene earlier and use less antibiotics, and improves animal health and animal welfare. Those same sorts of things can be applied, to medical records and decision making there. And so I think those are the areas that we have a lot of opportunity to continue to grow in and scalable. But there's challenges, not the least of which is data and managing all that data.
Dr. Habing, I'd also like to get your thoughts. I know you've been working on the cutting edge of looking at some of these scalable and innovative solutions in the dairy industry as well.
Yeah, just to piggyback on Paul's comments, the part that I would add on to that makes me optimistic is the application of advanced genomics within agricultural production systems to find disease-resistant animals. And so that's we might see really leaps and bounds in progress in terms of disease resistance and reduced need for antibiotic use. And so that's have to keep an eye on that area. So as far as innovative and scalable solutions across different contexts, I like that idea, although I think we have to keep in mind the uniqueness of each production system. So a 10,000 cow or 10,000 sow farrowing farm is a lot different than a 100 cow dairy farm, right? And so we have to be cautious about trying to find interventions that are going to be applicable to each of those situations, and kind of work with the agricultural professionals and the veterinarians that were within those systems. And like Paul said, they can, within their system, they can ask those questions: how can we improve within our system prescribing, and really kind of rely on the really innovative folks in agriculture to identify system-specific solutions for reducing the need or better targeting antibiotic use. The other part that we're working on is providing feedback to producers on their antibiotic use. And so they often won't get feedback on the quantity of antibiotics that they're using on their farms. They just might know that their drug bill is a little bit higher than what it used to be. And so we are quantifying antibiotic use on dairy systems and calf production systems, and then sending those reports back in the form of benchmarking reports, where they can see how much antibiotics they use, how many doses per 100 cows per month that they use relative to some of their peers. And so we directly compare them to their peers. And I'm not sure what the social scientist concept for this is, but nobody wants to be the worst, right? So that definitely prompts some improvement, and it has in other contexts when we've applied benchmarking reports to animal health. And as everybody has mentioned, there's a lot of different potential solutions to a lot of antibiotic use. And so then the farm can say, well, we need to improve on our antibiotic use. Where is the best opportunity for our farm to use less antibiotics? Maybe it's better targeting antibiotic use. Maybe it's on the prevention side, but it's likely going to be unique to that particular system. And so if that data becomes more routinely available within a larger production system, I could see that as kind of a scalable type of data feedback that would be useful for production systems to keep improving as far as antibiotic stewardship goes.
Absolutely. And I think even the process of going through exactly how that can be done in different production systems, whether it's setting aside a different waste basket to capture the vials that are used, to looking at a medical record system and extracting the data from that and generating reports. And I think you're right. It's probably very setting specific exactly how that's done, but lots of creative and innovative ways. And I know that our partners in agriculture excel in that area, which is great. So on this one, I'd like to hear from all of our panelists. So as we've been discussing, antimicrobial resistance in animals is an issue that really requires a One Health approach, and it reaches across countries and geographic boundaries. So how do we approach this holistically so that we're addressing it in all areas, knowing that use in one area impacts what we see in others? And Paul, I'd like to start with you on this one.
Sure. This is a kind of a topic that I think about a lot, and try and really think, how do we really take that holistic view? And at times I find myself thinking, we hear a lot of talk about One Health and stuff, but in many cases, when we really dig into what's happening there, it's one sector, vet medicine, human medicine, whatever, standing in their shoes in their sector, and just simply looking at the outside forces from the others. How does human health intersect a little bit with what I do, or how does environmental health? And I think to truly move forward in this process, we really have to get ourselves centered in the middle of that triangle or diamond, whatever it is, and be looking out at all the other directions. And so, to use an analogy, as veterinarians, we often talk about food analogies that we learn, and some of those are grotesque. This one hopefully is not grotesque, but this one's a colleague and friend of mine, Mike Dahlstrom, here at Iowa State, that focuses on team science and science communication, and how do we do better of pulling people together across this interprofessional education, one health spectrum. And he says, well, a lot of times when you're bringing folks from different sectors together, initially it starts out kind of like your dinner plate. There's the meat on one side, and there's the potatoes on the other side, or whatever the case may be, your vegetables on the bottom. You're all on the same plate. You're kind of working together, but you're really all very distinguishable, and you're not mixed together. You're still in your silos, but on a plate together. But the goal is to progress from that, and the next step is to kind of, again, a food analogy, be more a little bit like a fruit salad, where you're diced and chopped up, but you're in the same bowl, but they're still very distinguishable. Oh, that's a veterinarian, or oh, that's a plant scientist. But you're commingled and you're mixed together in that bowl. I kind of feel like that's where we're at right now with One Health. We're doing a better job of getting together and having those discussions, but you can still pick people out in those territories and say, well, here's our expertise. And that's important, because each of us have expertise to bring. But really, I think what we need to strive for is in his analogy, the fruit smoothie, if you will. And so where we share a common language, all of that expertise is put in together for the benefit, but we start thinking like the folks in our other sectors. I don't just think like a veterinarian, but I know enough. I'm not an expert in it, but I know enough about human medicine or environmental medicine. I've taken that upon myself to learn that information, to where I can better understand and make an educated guess about some sort of policy or activity that I'm going to do. And so what's that require? It requires us to all be together on more than a very infrequent basis, build those relationships inside and outside of the profession, and really appreciate what each person brings to that, and try and strive to share language, share common perspective, so that then it becomes more second nature for One Health to happen. And I think that's where we strive. We're partway there. We've always got opportunity to grow. but I do find even myself always looking at stuff through the lens of a veterinarian, because that's my professional training. And it's more than just stepping back and saying, well, what about human health or what about plant health? But really understanding and being able to at least have enough knowledge to recognize when there could be a big problem or unintended consequence there.
Absolutely. And Greg or Dan, either of you want to contribute to our food analogy? I like that. And the fruit smoothie is one of my favorites. That's making me hungry.
You know, Paul said it really well. There needs to be a lot of multidisciplinary action. And I would emphasize again, the implementation part, the social science and behavioral science part needs to happen. And that component, together with in the context of agricultural professionals, and trying to come up with the best way to implement systems that achieve our goals from a public health standpoint, but also accommodate or avoid unintended side effects on animal welfare, and then ensure, you know, economic sustainability of the production systems. And that requires a lot of different expertise, and no one person can do that.
Yeah, I think Dr. Palmer had the analogy of the day with the fruit smoothie. And, you know, just to add a little bit more to that, not only breaking down those barriers and integrating effectively between professions, but also within those professions too. Encouraging and engaging practitioners, human, environmental, and vet, is key. I haven't prescribed an antimicrobial drug in about 18 months. So yeah, I can look at these things and do analyses and data and attempt to publish results and things like that. But at the end of the day, unless we've got everybody at least on the same common denominator, it's going to be tough to merge between sectors. So absolutely the fruit smoothie, but we've got to incorporate all the fruits from those sectors. And really, public health is where that happens. Public health incorporates environmental scientists, human health professionals, and veterinary professionals. So bringing everybody under that One Health umbrella. And, you know, if there can be just the thinnest of silver linings with COVID, I think that can motivate us to really progress forward and consider all different stakeholders when trying to improve antimicrobial stewardship.
Thank you. And I think I'd like to go around among our speakers one more time and see for our audience today, what do you think are some of the key takeaways? What are some of the things that you might have learned from the discussion today, or even some of the previous AMR exchanges? I know for myself, I'm going to borrow that fruit smoothie analogy, Paul.
Anytime you talk about food, and particularly food that people like, they like to use the analogy. But again, I can't take credit for that. That's my colleague Mike Dahlstrom, but I think it's great and I use it. You know, I think a key take home for me, or a couple of key take homes, just very quickly. Number one, antimicrobial resistance impacts all of us. It impacts our potential health as humans. It impacts the health of our pets, and it impacts our food security and our food supply, both on the on the plant and on the animal side. So, you know, we very often think, and we focus today a little bit more on food producing animals. We didn't focus a lot on plants, but antimicrobial and antifungal resistance do impact food security through the plant side as well, and those public health. So it impacts all of us. And again, that idea of let's do a better job tomorrow than we did today. If each of us, when I go to the doctor with one of my kids, you know, a little bit less of that expectation that it has to, you know, that they have to have an antibiotic to treat that ear infection. When I go to the vet with my dog, you know, listen to their expertise. And when I'm working with a vet or a producer or a crop specialist in terms of applying to populations, what is the best measure of how we can do this and how do we measure those outcomes? Those would be my take homes.
I can go next. So for me, it's, participating in something like this and where we talk about the necessity of collaborative work makes me a bit more introspective and think about, well, how can I do better at that? And the default for me and probably other people is to really focus on the immediate concerns that I have for my research projects, for my teaching. And it's easy for me to fall into the siloed approach and just trying to get my projects done and trying to take care of what's happening right now or tomorrow. And then I have to make a conscious effort to participate in things that NIAMRI hosts, for instance, to try to build those multidisciplinary collaborations that are absolutely necessary to tackle this problem. So it's something that I know I need to be doing a better job of, and I can keep working on that.
Thank you. Dr. Taylor?
I think AMR affects us all. Like Dr. Plummer said, nobody wants to see their antimicrobial treatments be less effective or fail. There are challenges out there that I think we did a good job outlining today in terms of the data availability and the siloing of different professions. But there are collaborations going on to improve the issue, and that we all need to work together in our fruit salad world to improve outcomes.
Well, thank you all so much for joining me as panelists, and thank you to all who attended today. We really appreciate the discussion on today's AMR Exchange series and hope that you will join us in the future for additional discussions. So thank you all again for your time, and a special thank you to our panelists. I really appreciated the opportunity to discuss with you all today. Thank you, and have a great rest of your day.
Thank you, Megan.